interrupting the testimony.
I just want to let the witnesses know I've experienced, Mrs. Marks, what you have. I had a niece that had 2 brain tumors. She grew up with a telephone on this side and one on this side. And so I just want all the witnesses to know that I've gone through that experience.
I'm sorry.
I thank the gentlelady. At this point, Mr. Knapp, you may proceed.
Thank you, Chairman Kucinich and members of the committee. Very tough to talk after hearing that story. My heart goes out to you.
Thank you.
And I wish all the best for you and your family. My name is Julius Knapp. I'm the Chief of the Office of Engineering and Technology at the FCC, and I thank you for the opportunity to participate in this hearing. As you know, the FCC is responsible for, among other things, regulating telecommunications services and devices, everything from multi-kilowatt broadcast antennas to microwatt medical implants. Pursuant to the National Environmental Policy Act of 1969, or NEPA, the Commission has established guidelines for human exposure to RF radiation. The FCC guidelines, which were first established in 1985, regulate the amount of RF radiation to which humans may be exposed by various transmitters regulated by the FCC. The guidelines and methods for evaluating the environmental effects of RF have been revised as scientific knowledge in the area has advanced, and standard-setting bodies upon which the Commission relies in setting our exposure guidelines have revised their maximum acceptable exposure criteria. The current guidelines were finalized in 1997 based on recommendations and advice of federal agencies and groups with expertise in health-related areas and in standard setting. The guidelines were based primarily on criteria developed by the congressionally chartered National Council on Radiation Protection and Measurement and the Institute of Electronics and Electrical Engineers, which is within the broad umbrella of the American National Standards Institute. Their adoption was supported by the Environmental Protection Agency and other health and safety agencies. 4 years ago, the Court of Appeals for the District of Columbia upheld the Commission's continued reliance on its existing rules to protect the public from potential health effects from RF exposure. The standards guidelines specify limits for human exposure to RF emissions from handheld RF devices in terms of specific absorption rate, or SAR. For exposure to the general public, exposure of the user of a cell phone or PCS phone, for example, the SAR limit is an absorption threshold of 1.6 watts per kilogram, as measured over 1 gram of tissue. To ensure compliance with the RF exposure guidelines, cell phones must be certificated before they can be marketed to the public. In order to receive certification, each device must be tested to demonstrate compliance with the SAR standard. The test data and the test methodologies are reviewed before the certification was granted, and the test data, including the SAR values, are made available to the public and are on our website. In addition to establishing and enforcing the exposure limits, the FCC provides information to consumers and to industry through various publications and on our website. The FCC and the Food and Drug Administration have developed a joint website to provide health-related information for consumers who are concerned about cell phones, base station towers, and other transmitters and wireless products. Among other things, the joint website includes a link to the Commission's database of approved equipment and instructions on how to find the SAR information on individual cell phones. It also refers to outside sites that compile information on SAR for individual cell phones that may be in a more readily accessible format. In order to ensure the continued proprietary and efficacy of the RF emissions limits, the FCC staff continuously monitors relevant studies and literature and attends and participates in a number of groups and pertinent standards setting bodies. In addition, our staff participate with scientists from the federal health and safety agencies in an informal radio frequency interagency working group, which was chartered in 1995 to provide a coordinated federal approach to health issues. Although the Commission is responsible for setting and enforcing limits for RF exposure from devices that we authorize, it is important to understand that we rely on the guidance from U.S. health, safety, and environmental agencies in setting those limits. The FCC staff is not sufficiently qualified to speak with authority to the science of health effects of RF absorption in the body. If agencies with expertise on health effects of RF exposure were to suggest that our standards should be modified, the Commission would initiate a rulemaking to consider changes in the standards. In closing, the Commission recognizes the public concerns about cell phone use. The science concerning health effects of RF exposure from cell phones has been the subject of great study and debate. We are continuing to monitor the developments, and the Commission stands ready to take action if it appears appropriate to do so. Thank you.
Thank you, Mr. Knapp. Dr. Carpenter.